Dr. Puneet Jain.
A very good morning to everyone. So RB heavy session, I would like to conclude with a different tumor. So I'll be speaking on metastatic conjunctival melanoma. This study is supported by the Eye Cancer Foundation. So just a background, we all know that conjunctival melanoma is a very rare tumor, and there are reports which say that the incidence is on the rise. Despite the best local management as an ocular oncologist, the metastatic rates and the tumor mortality remains very high to the tune of 40%. Of late, systemic immunotherapy has been shown to be effective in control of metastatic disease. So this is a registry-based study. The idea of the conjunctival melanoma registry came into being on the first Eye Cancer Day. This is way back in 2015, almost a decade back, when 10 ocular oncology centers collaborated, and this was an internet-based data sharing study involving 10 ocular oncology centers from 9 different countries. So we analyzed the data. The data analysis began in somewhere in 2016. The first paper came out, which was basically to validate the 8th edition of AJCC, which was which just came out at that time. The second paper spoke about the local recurrence rates. This paper focuses, we further analyzed the data, and this paper focuses only on the metastatic subset of patients. So just to give an idea of the cohort, there were 288 patients in this study, and 75% patients were T1, CT1 stage, and there were no CT4 tumors in this study. So overall, 29 patients had metastatic disease, of which 5 had at presentation and 24 developed metastasis during follow-up. The ones that had metastasis at presentation, all of them were multicentric tumors, and 4 of 5 had plical and caruncular involvement. All were staged CT3. All were thicker than 2.7 millimeter. Lung and liver were the most common site of metastasis, and tumor ulceration was present in 4 out of 5 patients. Only one patient survived beyond 1 year. The rest of the patients passed away within 1 year of presentation. 24 patients subsequently developed metastasis in follow-up over a median follow-up at a median follow-up of 4.2 years. Of note was important that we would expect multi-organ metastasis in these patients, but in our study, liver was the most common sign of metastasis, followed by lung, and liver were the most common combination. And on the contrary to what we would expect, that local recurrence might precede a systemic by showing up of the tumor on annual monitoring, more than 50% of the patients develop metastasis without local recurrence in this study. The cumulative risk of systemic metastasis was less than 1% at 1 year, and it shot up to 22.3% at the 10-year follow-up. 17 patients out of 24 died in the duration of the study. Of note is that the data was collected prior to introduction of systemic immunotherapy, which has shown promising results in life salvage in such patients. Just to keep things in perspective, with every one stage increment in T stage, there was an 89% higher risk of systemic metastasis, and with every 1 millimeter increase in tumor thickness, there was 16% higher risk of metastasis in such patients. Another notable point was that upon spread, the distant metastasis was more common than the lymph node metastasis. Now, we usually in our clinics look at local recurrence and palpate the lymph nodes, and probably might be tempted not to get the systemic evaluation done. It just highlights this point. It's kind of a controversial point, but this is what our study found out. So all the patients with metastatic at presentation had 100% mortality at 2 years, and those with follow-up, if metastasis happened, had 10% mortality at 2 years and 40% mortality at 5 years. This is a busy table showing the comparison between the two groups. Of note is that multicentric tumors, plical and caruncular involvement, tumor thickness are very important factors for patient might be having metastasis at presentation if the patient were to present to you. This is where we compared our previous study where local recurrence was not found significantly associated with plical involvement, caruncle involvement, but metastasis was found to be associated. The weakness of the study is that it has a retrospective study with small numbers of T3 and T4 tumors, but it is a multicentric study that represents real-world outcomes. To conclude, this multicenter study was able to gather statistically significant data about rare ocular malignancies, and overall AJCC stage was higher and survival was shorter in patients with metastatic conjunctival melanoma. These are my references. Thank you so much.